Hey everyone, welcome to TimmyCare 101 training. My name is Kate. We're excited to have you coming on an upcoming Timmy trip, and you're going to be using our electronic medical record system while you are on brigade. So this is just an intro training to give you a quick peek into what TimmyCare looks like and how you'll be using it on brigade. So first things first, what is TimmyCare? It is our electronic medical record system, and it's used via an intranet. So all of our sites have a server, which is a laptop and a router that we will connect you to, and you will connect to our Wi-Fi. Now, because it's an intranet, you'll only be connected to TimmyCare. We're not going to have you able to access Wi-Fi during your brigade. So we ask that you download Google Chrome and you have that ready before you go. Once you're on your trip, you're going to sync up to the TimmyCare router, and you're going to connect to this by typing in an IP address right into your browser window. And it's here, and you're going to get it from your medical programs coordinator or your MPC on brigade. And you're going to connect into TimmyCare. And so this is what your home screen will look like. You'll see these different panels from registration to history, all the way down to the pharmacy. This is going to be your home screen in TimmyCare. So in order to navigate between the panels, you're going to click on any different section that you are assigned to during your medical service trip. And once you click the desired panel, you'll come to this second screen where you're entering a patient ID, either via their name or their number for the clinic that day, and that's how you're going to access their patient records. Now, anytime you're done with a patient and you want to go back to the home screen, it's important to know that in the top right corner, you can click the little door icon, which I have circled here on the bottom left photo, and that's going to exit your patient record and get you back to the home screen. And then I'm going to let you know one more thing about navigating TimmyCare. So it's very important that anytime you're working with a patient, double check the top of their page where it says their name, it says male or female, it has their age, and then the last grade box, which has MO, will be the doctor's initials that are treating the patient. So anytime you have a patient sitting in front of you, I just want you to double check to make sure that looks like it's the right gender, it looks like it's the right age. Sometimes we use duct tape or name tags to give our patients numbered IDs throughout the day. And if they're with a bunch of kids or it's dusty or it's windy, they might fall off. So I just ask that when you navigate through any panel, you're checking that the patient in front of you matches up with the corresponding record. If for any reason there was an error in the birthday or their gender or the spelling of their name, you can just double click the top bar on any patient file and it'll drop down to this picture, which is in the lower left-hand corner, and you can adjust that accordingly. So if it says the patient is 2,000 years old, you're just going to want to go back in and make sure they have the right date of birth. So that's mainly all there is to navigating TimmyCare. Next, I'm going to walk you through all of the stations so you're familiar with what the screens look like when you're there, and it should be easier to know and prepare for your trip. In addition, I'll give you some tips and tricks which will help you throughout the whole process of collecting the best data for our records. The first section that you'll come to is registration. This is the first station for all of our patients. They will have to check into registration to come into our clinics. The patient could be already in our records because they have attended a Timmy clinic, or they could be a new patient. It's very important to ask them if they've been to a clinic or this is their first time with Timmy. And so I'll walk you through the two options. First of all, for returning patients, you can search them by 3 different ways. You can search their government ID number, you can search them by date of birth and sex, or you can search them by first and last name. In this example here, in the bottom example, I typed in Maria, and you can see there are over 200 matches with the name of Maria. Once you find the patient, it may not always be the first patient listed, so make sure to go through the list, double check their birthday, and if you find the patient, you're going to click where the little arrow is highlighted in this bottom photo, and that will lead to create their clinic ID for the day. If you are looking add a new patient for a Timmy clinic, from the registration tab, you're going to click the top right arrow where it has add and then a person symbol. It's circled here in the photo on the top left, and then you'll create a new patient. What we are really looking for all of our new patients is that you enter their first and their last names, their date of birth, which you can see the format is different here. We do day and then month and then year. We enter their sex and their government ID if they have one. We also ask that we enter a phone number, and if they don't have a phone number, ask if their neighbor or a family member has one so that we can contact them if we need to. The most important thing to remember for any new patient is not only to click create, but to click create and register. That will give them an ID number for the day. For all of our patients, we have to go through this consent form. You will scroll to the bottom, click agree, and click continue. And then every patient that goes through registration, whether they're a returning patient or a new patient, will be assigned this number ID. And as you guessed, I said it earlier, we write the number ID either on a name tag or on a piece of duct tape, and we stick that on the patient, and they will have that number just for the day. That's their number for the rest of the day. We hope to see around 100 patients a day, and so we'll start with one and hopefully end up around 100. After they finish that registration section, don't forget we're going to click on the top right corner where the exit door is to get back to our home page, and the patient's going to move to the second section, which is history. History Station will really dig into why they're there for their visit and also some of their basic medical history. Every time you click into the History tab, you'll see the small top left corner photo where you can either enter their patient ID, which again would be, for example, number 1 through 100. You can search by name, and then the most recently registered patients will show here below on the top, and you can check with their name and their number and click either one of those to open that patient chart. Once you get into their patient file, the bottom right photo, you'll see the screen of what it looks like on the History tab. You will be able to have all of these questions and additional questions that are starred here below about pregnancy, breastfeeding, and the last menstrual period for any female of reproductive age. And if they're not a female of reproductive age, they will not have those additional questions. So something really great about TimmyCare is you can switch languages. So you'll highlight the little gear setting in the top right toolbar, and you'll circle the ES, which is for Espanol. And this is great and can be very helpful while taking history if you want to ask the questions in Spanish. And finally, while you're taking history, I like to ask 2 different questions. So on the left side of the history screen, you can ask the reason for visit. If they are presently ill, you can click the presently ill here like I did and type in what is going on with them today. This patient has dry eyes and they have knee pain. And what is very important about this section is it is the only section that does not automatically save. It does automatically save, but in the event that someone else would click a different category here, everything under presently ill will erase. So if I accidentally clicked well check and then went back to presently ill, this information wouldn't be here. But everything else in TimmyCare does save, and it saves all of the information no matter what. So it's good to know. And then on the right-hand side, you can enter the patient's preferred language, if they have any chronic conditions, if they have any allergies to medications, and those all should pop up with an auto-populated drop-down menu. And anything that asks about a calendar, such as the last parasite treatment, will pop up with an automatic calendar, so you can enter the date there. All right, so we'll get into our third section, which is the vital stage. All patients will get their vitals taken, and it's a pretty quick stage. It's fun. We have all of our patients come in. We take their height and their weight, we take their temperature, and we use an automatic blood pressure cuff to get systolic and diastolic blood pressure as well as a pulse. What I recommend is to take their height and weight in centimeters and kilograms so patients can understand they are using the metric system in all of the sites that we use. Once you enter the kilograms or degrees Celsius, it will automatically populate in the other measurements. So you can see here I entered 35.8 for their temperature. It auto-populated the 96.44 degrees Fahrenheit. In addition, if you have a patient with high blood pressure or you're not sure that the reading was accurate, you can enter the first reading and then you can click the plus measurement key to enter additional measurements, and that way we will track all of the blood pressure measurements throughout the day if we have a patient that needs to be closely monitored. After they get their vitals taken, we'll move them into the fourth station, which is labs. We will only send patients to the lab if they have a history of anemia, diabetes, if they're having urinary issues, or they think they are pregnant. We can send those patients to get a lab test done before they see the doctor. And for any patients that are needing additional tests, the doctors will send them back to the lab during their consult. So there's two different options for labs. I want to stress here that only a qualified medical professional should be handling sharps and reading the test results, but as a general volunteer, you're able to help enter this information into TimmyCare. This is what our lab page looks like, and I'm sure the medical professional will guide you on what information you'll be entering. Next, we'll go to the doctor consult. This is our fifth station for all of our patients. Our patients occasionally get bottlenecked here in clinic. They'll wait in line to see one of our medical professionals. All medical professionals will be assigned a scribe each day that will fill out this section in TimmyCare, and they'll enter all the diagnoses and prescriptions that are eventually sent to the pharmacy. Now, unlike any other section, the doctor consult page has 3 different pages for the scribe to complete. The first step is when you sign into any patient, it will ask you what your name was. You should sign into the TimmyCare patient based on what your provider's name is. And there should be a drop-down menu here for any provider on your brigade. So once you sign in, you'll see the first page. It will show you the reason for visit that was taken in history. It will show you the vital signs, and it will show you any lab results that were taken. In addition, it will show you any previous visits that the patient has, so you can click on the previous visits to see what happened during their last visit. What the scribe will write in on this page is highlighted by the blue box here, and that's where you can re-enter more information about their history of present illness. Now again, unlike the other sections, this is a 3-page section, and the way that you will navigate between the pages is through this sidebar, which is highlighted by this oval, and you have to click here, and once you kind of hover over it, the sidebar will highlight gray. That is how you navigate between the 3 pages of the doctor visit. As we move on to the second page of the doctor visit, you'll see the main exam page. You'll see all of the exams that can be done. You can either check that they are done or click the X if they are not done. You can click the plus ... to add any notes. I've done so in the HEENT section here. And medical providers have 2 different options for patients that need additional care. The first one, which is follow-up, is on page 2, and it is starred here on the page. This is if a patient doesn't require immediate follow-up, but needs to be monitored on the next brigade. And so what you can do is request that a patient has specific follow-up for their condition here on this page. Now I'm going to keep scrolling down. This is the bottom of page 2, and the bottom of page 2 is where you add any diagnosis or medication for your patients. This is the most important part for the scribe and probably the most difficult part to learn. What I will say is if you ever are questioning what's a medication or what's a condition currently in TimmyCare, you can click where this blue rectangle is and see the list of medications or conditions in TimmyCare. As far as adding a diagnosis, you'll click on the purplish blue box that says Add Diagnosis, and once you start typing in the diagnosis box, this will auto-populate. So here I am typing in well check. It came up automatically. And then I'm going to click Add Prescription. And I started to type in the information for a preventative parasitic treatment. And so here I've typed in albendazole. I filled in all of the other information. So here I've typed in 400. There is a drop-down menu to click milligrams. I have times that by 1, and I've picked the drop-down menu for pill, and I put the number to dispense, which is 1 pill. And so I added this under well check to make sure that this patient is being treated preventatively and not being treated specifically for parasites right now. Most of our programs offer parasite preventative treatments for adults once a year and for children every 6 months. Here are some more examples just so you can see the differences in how this section may be filled out. I've typed in for a patient that came in a general pain diagnosis, and I've added a prescription of ibuprofen. I've typed in all of the different fields, which is I've selected a 200 milligram tablet times 1 pill. I want them to take that 2 times a day for 60 days. So I'm dispensing 120 pills. There is a drop-down menu of the frequency, so it can be daily, 2 times a day, 3 times a day, 4 times a day, or before bedtime. You can also check this as needed for something such as ibuprofen, where they're only taking it when they're experiencing pain. In addition, I've added another example of dry and irritated eyes. I've prescribed the patient liquid tears, which I'm dispensing 1 bottle here. And I've also added a prescription of sunglasses. The really important thing for all of our scribes to remember is that we like to track every single prescription that's given out. That includes sunglasses, that includes reading glasses, that includes sunscreen. We also give our patients vitamins, and we ask that you record that as well. And you can record that under the diagnosis of well check and fill in children's vitamins, prenatal vitamins, or adult vitamins as well, even infant vitamins. Okay, and then remember to get to the 3rd page, we're going to hover on the right side of the screen, and this will take you to page 3. And this is the other type of follow-up that doctors can provide. So what the other option compared to follow-up is a referral. And a patient referral is for anyone that needs follow-up care through a local hospital or a local clinic after the brigade. You can check with your local MPC as to what options are available, but here in this example, I've added one in Quito, Ecuador. They're going to be referred to our main hospital at Padre Carollo, and I'm going to mark whether it's a not urgent disabling condition, an urgent, or an emergency life limb threatening situation. So here I've marked not urgent, and it's very important to fill out the date about a week from the day that you're there, so we know to follow up with them and take them for a referral. And it's very important to write a note about what is needing to be done, both in English and Spanish. Occasionally we will have our health promoters or our local nurses or local doctors doing the follow-up, and if the notes aren't in Spanish, it's hard for them to know what they need to take their patients for. And finally, the most important part is that you have to sign out as the doctor on every single patient. If there is not a sign out option, then the prescriptions will not be sent over to the pharmacy. And so everyone needs to sign off the patient before they move to our next section. Great. And then finally, we are at the pharmacy station, which is our 6th and final station for all of our patients. This is where we have our patients wait to collect their prescriptions, their reading glasses, their vitamins. All of our patients do receive vitamins, and all of them will receive a toothbrush and toothpaste as long as we have the supplies. The pharmacy page is a little bit complicated, but once you get the hang of all the different stages of the pharmacy, it's fairly easy to follow along. Once a patient has been signed off, their number will appear purple. You can see the patient in the short version has 4 different prescriptions, and if I click on that patient, the list expands to show all of their prescriptions. And if you ever need to check any of their vital signs while prescribing, you can click the little vitals tab. It's circled here on the page, and make sure to check their weight and height, especially for those pediatric prescriptions. Okay, and so once we go in and to look at each of the prescriptions that need to be filled, there are 5 stages that must be completed, and I've highlighted them here with a red box. When they're sent over, they are pending, and the 5 stages in pharmacy are reviewed, counted, approved, filled, or not filled. A nurse or pharmacist must review all of the medications at the front end, and they also must approve all of the prescriptions at the very end of the fill. What students do and general volunteers do on our trip is they take the prescriptions once they're filled by the pharmacist or the nurse, and they use the label maker to create a printed label for the patient that includes their name, their ID number, any instructions in Spanish for taking the prescription, and the expiration date. And we'll get into what the labels look like in just a few moments. The general volunteers also then count the pills and put the pills in labeled bags. Once all the prescriptions are filled for a patient, you can mark counted, and at that point their number will turn blue, and they'll move on to the next phase. Now, once all of the medications have been given out, the patient may no longer appear on the pharmacy page. In case you would like to see all of the patients throughout the day and keep a monitor their status, make sure they're all green and signed out, you can click this funnel on the top toolbar, click all, and you can see all of the stages along the pharmacy. In addition, if you're ever confused about what the color means corresponding to the patient, if you just hover over the number, you'll see the word of the stage that they're in. So you can see here, if I hover over 1, it will show finished in that bottom photo here. So as I mentioned, we now have this newest tech update, which are label printers. They're a thermal printer. They're a fast and convenient way to make labels for every prescription for all of our patients. And because they're printed, they're very easy for them to read and see without all of our terrible handwriting. What we do require for our label printers is that we have a laptop with a USB port, and we use at least 2 laptops in the pharmacy every day that are hooked up with 2 label printers. And the other thing that we ask that you download ahead of your trip is a Dymo software installed on your computer. We're looking at Dymo version 8.6.2. You can download it from the Dymo software, from the Dymo website. And in addition, the medical program coordinator should email you this information before your trip. So our label makers are thermal, as I said, which means they run on no ink. All we need is to hook them to a power source, and then we will have a USB connector, and we will put all of our labels and slide them all the way over to the left edge and feed them through the slot. Now, if there's any question about how to load the labels, feel free to reach out to that local NPC. They're the expert there on the ground and know what they're doing. But here's a quick guide in case you are having trouble. This roll of labels must fit really snugly all the way to the left side, and we need to make sure they're feeding through. If the labels are jammed, feel free to use this button to release the labels back up into the printer and refeed them in, and hopefully it will be working. Here's a quick example of what our labels look like. We are going to put our name in here of the patient. We'll put their medication name, and we'll have some instructions. It will say the number of pills dispensed and the expiration date. And once you have that software installed, your NPC will give you these labels that are already created, and the labels will help you see exactly, you can use the recently used. So if you have acetaminophen, you'll find it in your recently printed. And the really important thing here is to only click the print button once. Sometimes there's a small delay, but it will print, and we don't want to print a bunch of extra labels. So just a few tips to remember. TimmyCare is a really great way to collect our electronic medical records for our patients. When things are not working properly, and believe it or not, this happens, all you need to do is try refreshing the page. I always recommend clearing your browsing history, shutting down or disconnecting from the router. You can restart your device, your laptop, and try and reconnect to TimmyCare. And this often works for all of the little glitches that it might have. In addition, we just ask that you keep accurate and clean patient records. We use this information. I use it directly for future data analysis, and I like to make sure that all of those little things are being tracked and tracked correctly. So if you have any questions, track down your NPC and they will be able to answer them. And you have now successfully completed TimmyCare 101 training, and you're all experts. So this is just a quick preview. We hope that you have a great time in your brigade and that you love using TimmyCare. Thanks so much. Bye.